Hi, this is Dr. Bragg with a tip for a pain-free Friday. I've been asked by some of you to talk about a slip disc. So what is a slip disc? We call it a spondylolisthesis. That's when you're looking at the spine and one of these bones slips forward in front of the other. And when we do that, what happens is these nerves here can become irritated because the spine is made of bone, disc, and nerve. So whenever there's any movement of one of these bones, you can irritate a nerve. And that could cause you to have pain in the back or down a leg. Now, how do you know that you have one? When I'm sitting, like you're sitting, you usually won't have pain from a slip disc. But when you stand up and pain goes down your back to your leg, this is when you have to consider, do you have a slip disc, especially if you're standing and bending backwards. Let's pretend you're going in the refrigerator to get a bottle of water. When you bend forward, you won't have pain with a slip disc. But as you come out of the refrigerator with this bottle of water and stand up, you may have pain in your back going down the leg. So what can cause this? Birth defects, major trauma, fractures, overuse, surgery, tumors, or as you age, a degenerative disc. We see slip disc in a lot of young people who are wrestlers, horseback riders, or baseball players because they can break one of the bones in the back here that we call the pars, P-A-R-S, articularis, and they get a little hairline fracture, and this can cause the disc to slip. So what do? You can get an x-ray. And usually your doctor may ask you to get a flexion extension view in order to tell if you have a lot of movement when you're bending forward or bending backwards. And you can get a CAT scan always to get more detail about the slip disc as well. So we always want to know, what can we do non-surgically? Of course, you can take pain medication and you can do activity modification, meaning that you don't want to do as much standing as you can, because people with a slip disc, when they're standing or walking long distances, can get pain. But if you want to stay active, riding a stationary bicycle would be an activity that you can engage in, or aquatic therapy, using cold packs, going to therapy, and having maybe some mild manual manipulation. And you can also have an epidural injection where we take a needle in the epidural space, put some steroid around your nerve that has become inflamed or irritated, and that can help to reduce the pain. If you have severe pain, we can always recommend a semi-rigid back brace to help you with your pain as well. So if all of these measures don't work, when do you need surgery? If you fail those conservative measures, a fusion is usually what 60% of the people will get, and they will use rods and screws to stabilize the bones that are slipped. So that's a pretty big surgery. So you want to make sure that you try the conservative measures first. I hope this video has been beneficial to you and that you understand what a slip disc is. And we usually grade them 0 to 4. Obviously 0 means you're normal, you have no slippage. Grade 1 means back to that pancake. You have a little slippage where the disc has slipped off 25%. 50% would be a grade 2, 75% is grade 3, and grade 4 is where it's totally slipped off, and that is when you need surgery, usually for grades 3 and 4. Most of my patients who I've treated who have grade 1 and 2 can be treated successfully with non-surgical therapy, medication, braces, and strengthening their core muscles, the abdominal and back muscles. Now, I want you to go to my website, knockoutpain.com, and sign up for a free chapter from my bestseller, Secrets to Maintain a Healthy Back, and read an article about herniated disc, and that will tell you what my book teaches. I also have a chapter in my book about slip disc, and that book can be found on Amazon, Secrets to Maintain a Healthy Back. Now, I want you to like and comment and share this video with a friend. If there's anything that I've said on here that you have a question about, put it in the comments and I'll be sure to get back with you. Now, please subscribe below, and I'll be back again next week with another tip for a pain-free Friday.